So I think that it's meant to have about a 1 to 2% rate of keratoconus in the community. I do think we are seeing probably a bit more, and I think it's multifactorial. So, I mean, keratoconus, what it is essentially is it's a condition where the cornea or the front part of your eye, it's usually shaped like a soccer ball, so it has a spherical shape, and it basically becomes distorted and it becomes conical or cone shaped. So you get that cone shape, and at the tip of the cone, the surface becomes steeper and it becomes thinner. So they're like the characteristic, signs of it. And then you get the reduction in your vision. You get lots of astigmatism traditionally, and worsening short-sightedness. So, and then that comes with your blur and problems with your distance vision. Now, there's many reasons you can get keratoconus. There's obviously a huge genetic component. And then there's other external factors like severe allergy or atopy. So if you're a really bad eye rubber, you can trigger keratoconus. You probably already have some kind of underlying genetic predisposition, but it makes things worse, and it changes the shape of your cornea. Certain medications and certain syndromes that also can be linked to keratoconus. So there's different causes for it, but essentially it's a progressive condition. Usually happens in young patients. We see it most commonly in young males and females. There's certain ethnic or racial groups that are more predisposed to it. So we do see high rates in some of the Maori and Islander groups, and also in some of the Jewish populations. So there's definitely, and also some of the some parts of Asia also have higher rates. So there's definitely genetic component, there's definitely a racial component, and then there's the external factors like your eye rubbing, and all of these together cause this condition that's generally progressive. It usually stabilizes by the age of 40 in most patients, but again, variable. Medicine doesn't always follow the textbooks, but that's essentially what it is. And I mean, I guess we are seeing maybe a bit more in the community, but there's also an added awareness now as well. So you have to kind of balance the two. I think there's just been a lot of undiagnosed keratoconus that we previously didn't know it was there. And now, because we've got better technology, so we've got all our special scans that we can look at the cornea, I think we're just diagnosing more cases. I don't know if it necessarily means that there's more. I just think we're noticing more.
Yeah. And as you mentioned, it's an interesting kind of condition, because we're unlike, for example, myopia, which affects like young kids while their eyes are developing, and things like cataracts and AMD, which affects people as they get older. Keratoconus, it's something it seems to hit young adults, like you said. So it's from the age of what, 20 onwards?
Yeah, generally. I mean, I've seen it in a 12-year-old. I've seen it in teenagers, 16-year-olds, but it's generally early 20s to 30s, and then it progressively gets worse if it's untreated or undiagnosed, if patients continue rubbing their eyes, and that because they just don't know that that's something that will exacerbate it, and then it usually stabilizes around the age of 40. But as I said, I've seen 60-year-olds progress. So it just depends on I think it depends on your genetics. I think it depends on whether you're able to stop eye rubbing, from whether it's from allergy or from severe dryness. There's lots of reasons that people rub their eyes. I think also there's links with obesity, and CPAP machines can help with that. So positioning of your head when you're sleeping on a pillow, like if you're sleeping on a certain way where you're rubbing your eye, there's been links with that as well. So it does impact on sleep hygiene. It does impact on also treating underlying exacerbating factors like dry eye and allergy.